My name is Rebeca Wong. I'm a professor in aging and health at the University of Texas Medical Branch in Galveston. I'm an economist and population health expert and director of the Mexican Health and Aging Study, a longitudinal cohort survey supported by the U.S. National Institute on Aging of the NIH and the Mexican National Statistical Bureau. My co-authors and I investigated the impact of the COVID-19 pandemic in Mexico. We present our findings in our paper titled COVID-19 and Mental Health Outcomes of Older Adults, Evidence in Mexico, which appears in the 2023 Health Affairs Special Volume on COVID-19. We use data from 4 waves of the Mexican Health and Aging Study, from 2012 to 2021, to explore differences in 4 mental health outcomes among older adults: depressive symptoms, loneliness, life dissatisfaction, and foregone healthcare. We use 2 measures of COVID-19, diagnosed infection and experiencing a major COVID-19 related adverse event. We also evaluated differences across sociodemographic groups defined by sex, age, education, and urban-rural residents. Our findings show that the overall prevalence of depression among older adults did not significantly increase in Mexico during the pandemic, unlike the United States and United Kingdom, which reported significant increases during the pandemic. However, our results also show an elevated risk for negative mental health outcomes for older adults who experienced COVID-19 infection or who had major COVID-19 related adverse events. This effect, however, was greater for having a major adverse event compared to a COVID-19 infection, and varied across sociodemographic groups. Consistent with recent studies from wealthy countries, we found that COVID-19 influenced depression and loneliness and had a moderate effect on life dissatisfaction and foregone healthcare. We found that women and less educated people were at greater risk for depression and loneliness. Our findings add to the lessons for global health to be learned from COVID-19, particularly as we examine major COVID-19 related adverse events in addition to infection. We also studied a low middle income country, and we differentiated by sociodemographic characteristics. This research is important because it provides a fuller understanding of the pandemic's effects and may help identify the most vulnerable population groups.